treating anxiety without medication. Anxiety is one of the most common mental health challenges. Anxiety treatment without medication can and does work. It is important for people to work with a knowledgeable provider and discuss their specific concerns about medication. Shout it out. Talking to a trusted friend is one way to cope with anxiety. But there's something even better than talking: screaming at the top of your lungs. As a kid, you were probably taught not to shout and told to use your inside voice. But as an adult, you can make your own rules. So if you're dealing with pent-up frustrations and anxiety, let it out. This doesn't mean putting fear in others so they feel on edge like you. We're talking about a healthy release of emotions in a controlled environment. The more you fight anxiety, the more overwhelming it can become. Instead, embrace anxiety as a part of your life, and then let it go. Exercise can help manage symptoms of anxiety and, in some people, may even be a substitute for other types of treatment. A 2018 systematic review and meta-analysis found that aerobic exercise, especially high-intensity exercise, could be particularly beneficial. However, the authors of that study cautioned that the wide variability in types of exercise included in the review and the small sample sizes of many studies limits the data. Scientists must continue their research to prove conclusively that exercise is an effective treatment for anxiety. Psychotherapy is a highly effective intervention for anxiety. In fact, the American Psychological Association emphasizes that therapy is typically more effective than medication. This is because psychotherapy gives a person the chance to talk about their anxiety, explore coping mechanisms, and work through experiences that contribute to their anxiety. Cognitive behavioral therapy, CBT, may be particularly effective. This treatment focuses on helping a person understand the connection between their thoughts, emotions, and behaviors. Through treatment, a person learns to disrupt automatic negative thoughts and find alternatives to anxious patterns of thinking. Diet and nutrition changes. Reducing caffeine. Try reducing caffeine intake, especially late in the day or before bed. Caffeine is a stimulant, which means it can speed up activity in the brain and body, making a person feel restless and anxious. Several studies suggest a link between caffeine and anxiety, including a 2015 analysis of school children that linked high caffeine consumption to higher stress and anxiety. Drinking less alcohol. Though few studies have directly assessed the link between alcohol and anxiety, many find that people self-medicate with alcohol. Some drinkers report an improvement in anxiety symptoms when they stop drinking or reduce their alcohol consumption. Keeping a food log. Keep a food log to assess whether anxiety is worse after eating certain foods. A 2019 study found a correlation between a high intake of saturated fats and added sugars and higher overall anxiety in adults. The study suggests diet may affect mental health, but it did not establish a causal link. Support groups. Anxiety can be very isolating. Support groups help people with anxiety feel less alone. They may also offer practical wisdom that can help a person find the right provider, talk to their loved ones about their anxiety, or manage the process of seeking workplace accommodations. Support groups come in many forms, such as anonymous online message boards, in-person meetings, and virtual sessions. Some therapists also facilitate support groups. A person should consider their schedule, comfort level, and goals when deciding which type of support group to try. Social support. People with anxiety need support from loved ones. Education about anxiety may help families better support children and other loved ones. Educational and workplace accommodations may also help. They can prevent anxiety from causing additional stress, such as from the loss of a job or a failing grade. Transcranial magnetic stimulation, TMS. Transcranial magnetic stimulation, TMS, is a newer anxiety treatment that uses magnets to create a weak electrical current in the brain. This current may stimulate the release of neurotransmitters that relieve anxiety or change how the brain processes anxiety. Doctors are not totally sure how it works. Meta-analysis suggests that TMS may help ease symptoms of generalized anxiety and post-traumatic stress disorder, PTSD. When to contact a doctor. Most people experience anxiety from time to time. When a person has anxiety so intense that it undermines sleep, daily functioning, or relationships, it is time to seek help. This type of anxiety is a medical condition. And while medication is an option, it is not the only treatment. A doctor can help with getting the correct diagnosis, ruling out physical health issues, and finding therapy and other remedies. A person should contact a doctor or healthcare provider if they experience the following: they feel chronically anxious for no clear reason or have constantly shifting anxieties. Their anxiety is disproportionate to the stress they feel, such as if a person who has a relatively safe and comfortable life is chronically afraid of violence or starvation. They experience panic attacks or physical anxiety symptoms, such as a racing heart or stomach pain. Their anxiety treatment does not work or suddenly stops working,